So Sam, your book champions patient empowerment through data control.
Yeah.
How is Dedalus enabling patients to securely manage their health data and also make well-informed health decisions?
Yeah, and that's an interesting one. So first and foremost, if you think about data, today Dedalus probably would be the largest custodian of data outside the US, right? So that's a lot of information for a lot of people. In many countries, we work with the regional government bodies to create things simple like patient apps. People could log in and check their information. And more, one of the things that we also do when we create these patient apps is we allow for other providers to build applications on top of that, right? So we create these open APIs and give those open APIs to many different, especially AI vendors. We have a lot of AI builders that come in and put their own applications on top of ours and build meaningful use. Just to give an example, there is a number of patient apps that help people, simple like pedometers, for example, right? So people do a lot of walking and they're also managing their diets and all of that they're sending to their doctor through the patient app. And all of that's creating data. And then you're taking that data and you're helping that patient understand where they're going with that information and how well they're going up against their treatment. So that sounds quite simple, but there's actually a lot of work in the background to create that, right?
100%, yeah. Also, I have to ask, is the whole 10,000 step thing a myth?
No, I mean, look, I think that's the starting point, right? So you got to start with 10. I find sometimes I do 20, sometimes I do 30. It really depends on the weather mostly.
Yeah.
Right. So we always have to be careful. But looking at the ecosystem of applications, it's really become such a great market. One of the ones I really enjoyed looking at just recently is an application around sleep. And people forget that one of the critical points of being healthy is giving yourself enough sleep, allowing for your body to rest. And it's not just about the sleep, it's about having a deep sleep, right? And people forget, sometimes they'll go out and they'll eat late and do all kinds of things. They don't sleep comfortably. So these applications are just really simple, just watching and tracking your sleep and how deep your sleep is, and then making small changes to that. So, let's say tomorrow I won't drink a coffee after 6 o'clock and seeing how that affects my sleep. Or, if in the region here, people eat quite late. So let's say, I won't eat mansaf at 9 or 10 o'clock at night, or whatever that people like
We
to
love that mansaf at 10 at
hummus or
night.
shawarma, whatever it is that you eat really late at night that people like to do, and then going to bed. So, these just small things like that, making the alterations to your own daily routine. And there's all these great applications that were built to help you, to guide you, to give you coaching. And they cost next to nothing, right? And they all sit on top of the data that you are creating every day.
Exactly, and this brings us into actually, you talking about sleep and steps and whatnot. Obviously, wearables is a big thing at the moment. We can manage our own data. We can kind of make decisions around that. Obviously, in the future, when we start sharing more of this data with our healthcare provider, they would say, okay, yes, so you did walk, well done. Yes, you're doing your thing. Or no, actually, you didn't really do anything, so maybe you need to step it up a little bit. No pun intended.
Yeah.
But so this is the thing, with regards to transparency, I kind of like the fact that I know what data I have and what I'm sharing. In terms of the wider healthcare industry, would having complete transparency about our shared data empower us further? Like, for example, would it make us, as the public, want to positively impact our health more? Or even, can I commercialize my own health data?
It's a very good question.
Why is it that somebody else?
Well, today, it depends on where you are.
Right.
You can't. But there are many countries that you can. And again, this is where the book talks about how you could potentially monetize your own data, how your data becomes a commodity, right? Especially with, I will take you back a little bit to the whole wearable device piece, right? So now you have these wearable devices and the whole IoT network, and that allows you to have a lot more data created that you can visibly see very easily, right? And because of that, there are companies out there that are interested in that information and they want to buy that data, especially if you have some kind of disease prevalence. So they want to be able to track, monitor, and see, well, if we give you that drug, how are you reacting? Or if we give you something else, how are you reacting? If you make interchanges into your daily routine, how is that reaction happening? So, you know, your data is valuable. You could say that a healthy 20-year-old data versus a 70-year-old with multiple diseases, which one is valuable? Which one's more valuable? So then you start to compare, 70 years of data versus 20 years of data, and so forth and so forth. But the reality is there's definitely value in there for somebody. It's kind of like saying it's in the eye of the beholder, right? Whether it's a pharmaceutical company or it's a research organization.
100%. And even when you look at, research, the data collected from research is predominantly, this is proven, it's predominantly, based on men, Caucasian males, basically.
Correct.
Because over the years, it was white men who went to take part in trials. Whereas now we're diversifying data and it's all sorts of backgrounds, races, etc. So, yeah, it's the question of what's more valuable in the long run.
Yeah, and I think the answer is everything. Right? Everything is of value. It may not be of value today, but certainly in the future, we may be able to come back and go, that thing that I wanted to know about, I actually want to know about it now. I didn't want to know about it 10 years ago, but now I do. And you can take that information and reassess and re-examine it, which is great.
Absolutely.